I'm Amy Donahue. I am a certified genetic counselor with Froedtert and the Medical College of Wisconsin Health Network. My pronouns are they, she, he. I use all pronouns. And as a clinical genetic counselor, I see patients in various specialties, including endocrinology, nephrology or kidney disease, ophthalmology at the Eye Institute, and also some specialty rare diseases and complex hereditary disease. My education, I got my Master's of Genetic Counseling Studies at the University of Wisconsin in Madison, and I've been practicing since 2018 as a genetic counselor. I have a previous career as a medical librarian, and I got my Master's of Library and Information Science at the University of Washington in Seattle. So my background in medical librarianship supports my clinical genetic counseling practice because I love helping patients find the right information to help them understand. In my practice as a genetic counselor, mostly I see adult patients, with the exception of the Eye Institute. For inherited retinal diseases, I will see patients from 2 months old to 105. But mostly in general, for the complex disease, for endocrinology, for kidney disease, it's adult patients over the age of 18. My particular areas of focus and interest are in the overlap of complex disease, eye diseases, and kidney disease, which all have some shared genetic components for many of them. So it's a nice overlap in all of those really different specialties that can sometimes serve my patients well in terms of referrals to other sides of things and everything as well. And really in the family histories of these conditions, and really helping patients understand that even if there isn't a family history, that doesn't rule out a hereditary condition. How a patient comes to see me is typically through a referral from a specialist, so from an endocrinologist or from a nephrologist, but occasionally it is from a primary care provider, and patients can self-refer. They can start the process themselves if they're interested, for sure. In some ways, a genetic counselor is a one-time touch. We see a patient for the genetic counseling. We don't always do testing. We help the patient decide what's right for them, and we'll help them communicate that decision to their provider. But if we do move forward with testing, we get the results. I help the patient understand what the results mean for them and their families, and then work with the referring provider on making sure they also have the results, and they will use those for the actual patient's medical care. My philosophy and what patients can expect when they walk in the room with me is that I both want to make sure that I am addressing the patient's questions and also the referring provider's questions. So helping make sure the patient understands why they're in the room with me, and having a conversation. I really like learning a little bit about the patient through that family history. I learn about them as well as their family, and even if they don't know their family history, that's something right there. So it's a conversational relationship, and just helping people navigate that process and answering questions, and then making sure my patients know that I continue to be a resource. Even if the only time we meet face-to-face is in that appointment, I am available and I can continue to be a resource for them, and I am part of their team.